Breast cancer is the most prevalent cancer amongst women in South Africa, affecting 1 in 28 women and up to 1 in 8 women in urban communities. The incidence is as high as 1 in 8, but early screening and detection of the disease dramatically improves the woman's chances of survival and reduces the need for aggressive and invasive treatment. As we celebrate Breast Cancer Awareness Month in October, women are encouraged to regularly self-examine and have an annual mammogram from the ages of 40. Now, Dr. Peter Schoub, Secretary of the Breast Imaging Society of South Africa, joins me for more on this. Dr. Peter, good evening, and thank you very much for your time. Thanks for joining us today.
Thank you.
What are the chances of survival, and what are the measures that one puts in place to reduce the need for aggressive and invasive treatment? I think let's start there.
Okay, so the good news is that these days the survival for breast cancer is actually very good. And probably 85% of women diagnosed with breast cancer are going to survive, or rather they're not going to die from breast cancer. Obviously it varies. It depends on how early we find that cancer and the type of cancer. So that really is why we emphasize early diagnosis. If we catch a cancer when it's small, before it's spread, the chances of getting rid of it are much better. If a person comes in late, then it's going to be difficult to get rid of it.
Now, there's emphasis being put on early, as you mentioned, but also accurate detection. Why the emphasis on accurate? Are there other methods of detection that aren't as accurate?
Well, I think that the gold standard for picking up breast cancer in the community is mammography. A mammogram is basically an X-ray of the breasts. And it's something that we ideally would do on all women over the age of 40 across the whole population in order to pick up cancers before they become clinically evident. The problem is, unfortunately, like with much else in medical care in South Africa, there's a big disparity in breast services. And mammography outside of the urban areas is very inaccessible. And therefore, there's no national screening with mammograms. And the recommendation is that women do self-examination or go to their clinic, the clinic sister or the doctor. That is not as accurate as mammography, but it's better than nothing.
Yeah. Now, you're saying the whole point of screening is that it happens before the disease is clinically evident. What does that mean? It means before the disease shows symptoms.
Exactly. So we want to catch cancers long before someone feels a lump, or even if they feel a lump, to be able to diagnose it right there and then and not wait until it has advanced. Because the biggest determinant of survival is the stage of the cancer, and the stage depends on the size of the tumor and whether it has spread first to the lymph nodes under the arm and then to other organs in the body.
Now, let's talk about the other technologies then that are available, imaging technologies I'm talking about, including the tomosynthesis, the C-view imaging, and contrast mammography. How do those play, and what benefits do we get from them in this fight against cancer?
So although mammography, like I said, is the primary test that we use, and it's extremely good at picking up early breast cancers, it sometimes is limited if a woman has very dense breast tissue. Dense tissue means very thick tissue, a lot of breast glands compared to fat, and that's a hereditary thing. So in a case like that, which is about half the population, mammograms are not as effective. They can't, the x-rays are often blocked by the thick tissue. So there are other technologies that have been developed in order to help us find cancers in those patients with thick tissue. One is tomosynthesis, which basically means a 3D mammogram. And many practices in South Africa are using this as a standard now. It's not an additional test. It's instead of an ordinary mammogram. A lot of patients will get ultrasound examinations, as an extra test to make sure we haven't missed anything. Contrast mammograms at this stage very limited, mainly in the hospitals. And then breast MRI, which is where we do an MRI scan of the breast, most sensitive test we got. That really is for higher risk patients or for patients who've been diagnosed where we want to see the extent of cancer.
Now, there are many women who are being deterred of screening or being persuaded by some kind of radiation risk. What are the harms associated with screening and the amount of radiation that is emitted? I mean, is that dangerous?
Okay, so a mammogram is an X-ray, and with X-rays there is radiation. However, it is an extremely low dose of radiation, less than a chest X-ray, probably less than a person going on a long overseas flight will receive. It's a very low dose. Now, when we consider that mammography has been around for 40 to 50 years, there have been tens of millions of studies done, lots of trials. They have never, ever shown a connection between mammograms and developing a breast cancer. What they have shown is how much screening mammograms have decreased the number of people dying from breast cancer every year.
Now, in terms of the cost, I mean, you did mention, for example, that mammograms become less accessible the furthest you go from urban settings. But what is the cost attached to this?
Okay, so if you are lucky enough to be on a medical aid, most medical aids will pay for a mammogram either every year or every second year from the age of 40. And there are many private mammography centers, especially in the larger urban areas. If you are not on a medical aid, but you live in a big city like Johannesburg, the larger government hospitals also have mammography units. So, for example, in Johannesburg, at the Johannesburg Hospital, Rahima Musa, Baragwanath, and Helen Joseph all have extremely good centers that anyone can attend. In terms of the actual cash price, if a person was paying for it out of pocket, they would probably be looking in the region of 1,800 Rand.
Yeah, and the whole thing of overdiagnosis. I mean, there are some international organizations that are claiming overdiagnosis of breast cancer. Is that just a vastly inflated idea? Is there such a thing happening?
I think it is inflated. So the theory with overdiagnosis is that by doing as many mammograms and tests that we do, that we're picking up cancers that would potentially never be deadly. So we're overdiagnosing, and as a result, patients are being operated on or treated that don't need it. The reality is that I think in this day and age, when we diagnose cancers, when the pathologist looks at the cancer and tells us what type of cancer, we can get a very good idea of just how dangerous that cancer is and what the best treatment is. So I really don't think that overdiagnosis is a reason not to do these tests, because the treatment and deciding what treatment is done is so much better than it used to be. And I think it would be wrong to deprive women of early diagnosis because of a theoretical risk that a cancer is not that dangerous.
Now, we've said all that, Dr. Peter, to come back to this point as we wrap up the conversation. Who is at risk of developing breast cancer?
Okay, so women, obviously. Now, you may have heard that men get breast cancer, and that is true, but it is very, very rare in men. So the first thing is a woman. Secondly, we see that breast cancer becomes more common with age. So women younger than 40, we do see cases, but it is much less common. The most common age group is 50s and 60s. And then there are certain risk factors, in other words, things that make a woman have a higher chance of getting a cancer. For example, family history. and this is especially if it is a mother or a sister. That's the most important. There are some other things like obesity. If someone's very overweight, they're at a higher risk. If a woman has dense breast tissue, like we mentioned, and that's something you'll only know if you've had a mammogram, you're at a slightly higher risk. If you're on hormone replacement, if you've personally had a cancer, and there's a number of other factors that put someone at a higher risk. But the vast majority of breast cancers happen in women who have no additional risk, women who have no family history at all.